10 strange symptoms of diabetes on your skin. It is critical for your health to be aware of the indications and symptoms that your body provides you when anything is amiss. Diabetes is especially crucial to recognize early warning symptoms because the ailment can have devastating consequences if left untreated. In this post, we will look at 10 unusual skin indicators that may indicate diabetes. It is feasible to reverse insulin resistance and prevent the evolution of diabetes by paying attention to these indicators and taking appropriate measures. 1. Acanthosis nigricans, dark skin patches. The emergence of black, velvety patches on the skin, usually in the folds and creases of the body, is one of the symptoms of diabetes. Acanthosis nigricans is the medical term for this ailment. These patches are caused by an increase in insulin synthesis, which can develop to insulin resistance. Acanthosis nigricans is commonly found on the neck, armpits, groin, and other sites of friction. Acrochordons, skin tags, are flesh-colored growths that protrude from the skin. While they can be harmless, they are usually linked to diseases such as diabetes. Insulin resistance and hormonal abnormalities are thought to be the causes of skin tags. They are most common in places where the skin folds or rubs together, such as the neck, armpits, and groin. Numb feet, neuropathy. Neuropathy, a disorder that affects the nerves, can cause tingling or numbness in the feet. High blood sugar levels in diabetes can damage the nerves, causing symptoms such as tingling, numbness, and burning sensations. If you have these symptoms, you must see a doctor for a proper diagnosis and evaluation of your condition. Onychomycosis, fungal toenail infections. Diabetes makes people more susceptible to fungal infections, such as onychomycosis, a common fungal infection of the toes. Fungi can thrive in an environment with high blood sugar levels and a weaker immune system. If you detect changes in the color, texture, or thickness of your toenails, get medical assistance immediately, as fungal infections can be difficult to treat in diabetics. Ulcers, bed sores. Bed sores, commonly known as ulcers, are a symptom of poorly controlled diabetes. Diabetes can cause poor blood flow and decreased feeling in some parts of the body. Pressure ulcers can form as a result of this combination, especially in those who are bedridden or have limited mobility. Immediate medical intervention and careful care are required to keep these ulcers from worsening. Fingers with hard skin, digital sclerosis. The thickening and tightening of the skin of the fingers is referred to as digital sclerosis. It is frequently linked to diabetes and is thought to be caused by abnormalities in connective tissue and blood flow. The skin may appear waxy, tight, or glossy, and finger movement may become restricted. If you detect any of these changes, you should seek the advice of a healthcare expert. Forward pulling of the fingers, Dupuytren's contracture. The condition Dupuytren's contracture causes the fingers to bend into the palm of the hand. While the precise etiology is unknown, it has been connected to diabetes as well as other risk factors like heredity and age. This disorder is caused by an accumulation of collagen beneath the skin, causing the fingers to gradually pull forward. If you encounter this symptom, it is critical that you get medical attention for correct treatment. Diabetic dermopathy shin spots. Diabetic dermopathy is one of the most frequent skin disorders connected with diabetes. It occurs on the skin as light brown or red scaly areas, usually on the shins. These patches are thought to be caused by blood vessel alterations caused by elevated blood sugar levels. While they are normally painless and innocuous, they might be a symptom of underlying diabetes and should not be overlooked. Eruptive-xanthomatosis, skin bumps. Eruptive-xanthomatosis is a skin disorder that causes tiny, yellowish lumps to appear on the skin. These itching lumps can appear on the arms, legs, buttocks, and trunk. Eruptive-xanthomatosis is frequently associated with poorly controlled diabetes and high blood fat levels. If you encounter these symptoms, you should seek medical attention to discover the underlying reason and the best course of therapy. Periorbital edema, puffy eyelids. Another cutaneous indication of diabetes is puffy or swollen eyelids, known as periorbital edema. The precise mechanism underlying this illness is unknown, but it is assumed to be connected to fluid retention and alterations in blood vessels. If you observe recurrent edema or puffiness around your eyes, you should see a doctor to rule out any underlying health issues. If you have any of these skin signs and symptoms, you should see a doctor and request a HOMA-IR test to rule out insulin resistance, prediabetes, or diabetes. Early detection and treatment can help you avoid complications and improve your quality of life. Aside from medical intervention, certain lifestyle adjustments can help reverse insulin resistance and diabetes. You may take charge of your health and lower your chance of developing diabetes by avoiding high glycemic foods, including healthy fats, consuming anti-diabetic herbs and spices, eating organic cruciferous vegetables, practicing intermittent fasting, and prioritizing sleep. Remember to get personalized advice and support from a healthcare expert when dealing with insulin resistance and diabetes.